Welcome everyone to session 2 for this morning. This session explores how the COVID pandemic has impacted employers and employees, but how it's also provided an opportunity to explore new ways of working. I'd just like to add, so my name is Sarah Rhodes, I'm the chair for this session, and just to reiterate that this session will also have a panel discussion at the end, so please pop your questions into the Q&A and we will endeavour to cover as many of them as time allows. So it gives me great pleasure to introduce our first speaker for this session, Paula Lorgelly, who is a chair in health economics at the University of Auckland. Over to you, Paula.
Kia ora. Hopefully you can see the right screen. Yes. Tēnā koutou, ko Paula taku ingoa. So many thanks for the invitation to speak today. So to follow on from that introduction, I'm a health economist, and for some reason, but an excited reason, I ended up landing and doing a lot of research on economic questions around long COVID. So I wanted to spend the time today to talk a little bit about productivity, which has been bandied around a little bit, and it is I say bandied around and more loosely than I needed to. It is hugely important and it should be a focus. I wanted to define it, and then I wanted to show you some of the evidence around this. And I know I'm teaching some of you to suck eggs, so to speak, because many of you are living this, and many of you are employees and employers and businesses, and trying to even create policies to address this. So I like analogies, and I was trying to think of an analogy, or this might be an idiom, and it's kind of the idea of an iceberg. And I actually think it fits in with the kind of clinical and epidemiological view of long COVID as well. The notion that there's a huge number of undiagnosed individuals kind of lying below the surface that we don't see. Putting it into an economic context, the iceberg represents the cost or the burden of illness. And mostly what we see is above the surface. So it's the direct medical costs of disease, or the health professional consultations, your diagnostics, your medications. But what lies below the surface is the indirect costs, many of which are these productivity costs or productivity losses. And they can be shown in other diseases to be up to 3 times the direct cost. So the iceberg below the surface is considerable. So taking this kind of broader economic perspective first and thinking about it being all-encompassing, there's this idea of productivity loss is a way to measure economic performance. Okay, so how much output an individual produces. And if you think of it collectively, then when we're all working or in our other activities, we're often contributing to the economy. And so when an individual takes time out of the workforce due to illness or injury, then that represents a loss not only to themselves, potentially in the form of income, depending on whether they have an income protection model or sick leave, but also a loss to the economy. And that economic loss is what impacts society, and it's called lost productivity. And I wanted to highlight that this is, according to Treasury, New Zealand's greatest economic challenge. Okay, so the more productive individuals are, then the greater our economic performance, our wages and our living standards. Okay, so the Treasury highlight this themselves, and I'll come back to this concept of what Treasury do and don't know. So how does COVID, affect productivity? And the speakers already today have touched on this, but the McKinsey group have actually done a really nice categorization of this. So when you have your acute illness, you have these missed work opportunities when you're unwell and so you're not working, or potentially very much against medical advice. Some people are still working, but they may be reducing their hours. There may be a lost productivity due to isolation protocols. So if you have test positive still in Aotearoa, you need to isolate, and therefore you're not in the workplace. There will be this increased caregiving responsibilities. People need to care for their friends and whānau who are unwell, And then also this last one, which is the idea of long COVID, so the long run consequences of the illness. There was also much discussion when we were in that kind of acute pandemic period about our pandemic response and lockdowns and what they did for productivity. But we're not in that space now. So we're now more in this kind of living with COVID. What are the consequences of that? And so McKinsey then followed that up with some really nice estimates of quantifying the days lost. And so here they said they have a low, medium, and a high estimate. So pick the one in the middle. And they thought it was like 83 million days lost due to long COVID. Other analyses from the Brookings Institute suggest that 2 to 4 million people may be out of work as a result of long COVID. And they think that 1/3 of the current workforce shortage, so they have 11 million vacancies in the US, they think 1/3 of those vacancies are due to long COVID. And I think we've all heard the notion of the great resignation that happened during the pandemic. There is some suggestion that might be a symptom of this mass disability event, and potentially the idea that those in the 50 to 69-year-old age bracket are taking early retirement on medical grounds. So it's kind of significant. Following on from that and thinking of the other parts, the kind of that iceberg of the burden of long COVID, one of my colleagues in the US, David Cutler, has estimated that long COVID cost the US economy 17% of its GDP. So he looked at the quality of life that is lost, the lost earnings, the medical expenditure. And in fact, he didn't, in that estimate, look at the effect of lower productivity. So it's even going to be greater than that. Mona's already given the statistic, which is just an estimate of the fact that they think about 80,000 individuals have left the workforce in the UK around long COVID. And we're getting similar statistics out of Australia. And so the Australian Treasurer, had said that the labour market has been smashed and that long COVID is increasingly contributing to that. And this is a country, remember, that has a similar elimination approach. Subsequent to those estimates from Treasury, Impact Economics and Policy estimate that the economic cost is about 100 million a week. And this led into the resulting parliamentary inquiry, which is underway. It's not getting a lot of coverage here, but in some of the Australian newspapers, there are some of their submissions are being discussed. And I know a number of economists who've put in submissions, so that sort of evidence will come out. Okay, so we like to see what everybody else is doing, but what are we doing in little old Aotearoa? So what's the evidence from this country or this team of 5 million? Well, the only evidence we have is the excellent Victoria University study, and they even say that that's an underestimate of the true productivity loss. And so you're kind of in this space where you think, well, there's a lot of government agencies globally that are asking the question about productivity loss or the economic cost of long COVID. And if you think back to that little teaser that I put on the third slide, which is the idea that Treasury said that, you know, productivity is New Zealand's greatest challenge. So you might think that Treasury were doing something in this space. And I suspect due to a very good investigative journalist, there's been a couple of OIA requests. The first one was in early 2022 and asked, you know, what does Treasury have when it comes to looking at advice or assessment of the impacts of long COVID? Treasury does not hold that information. Following up from that, a lot of the evidence they did present actually started to come to light in 2022. So you might have just thought, you know, there's more evidence now. Treasury must be looking at something. Another OIA request, any information on the impact, whether the impact relates to economic or fiscal or employment impact, and even explicitly asked them, are they looking at the evidence from outside of other countries? Again, Treasury does not hold information relating to this request. And I haven't gone through them meticulously, but they used to do a weekly economic commentary, and those commentaries, they talked about the impact, the acute impact of COVID and the productivity loss. they then rolled those COVID statistics into their standard weekly, now fortnightly economic commentaries, but there is no discussion at all about long COVID. So if you come back to this notion of what Michael Baker called recently, you know, the biggest disability events, you know, the idea that the condition could be New Zealand's leading cause of disability, the fact that there is almost clear silence from the peak economic agency is sad. And so there's other evidence as well from other countries. So there's evidence from the New York State Insurance Fund, which is kind of similar to ACC. And they're able to follow their individuals and see how many of them are off work. There's even evidence that presenteeism is on the rise. So we're unwell but going to work. You know, obviously we have more insecure jobs, more financially insecure, in the cost of living crisis. So we're potentially even exacerbating the condition.
Can I just get you to wrap up, please? Paula?
Yeah.
Thank you.
So what I wanted to say is don't despair and don't be all doom and gloom. And Freya highlighted this. So the Ministry of Health has funded a long COVID registry. With myself and the amazing Janine Crossan, we are going to establish a means of recording what individuals' experiences with long COVID. So we'll ask about symptoms, healthcare contacts, and time off work. And it will provide a means to kind of monitor the condition and also explore inequalities to understand how experience differs across socioeconomic ethnicities. So the idea is there'll be I'm
going to have to stop you, Paula, sorry, because we really need to run to time. Look, thank you so much for that presentation.
Put your hands up and be counted.
Put your hands up and be counted, absolutely. Thank you so much. I really appreciate this is an important piece of information here as well, and these slides will be made available. So I'd like to move on and introduce our next speaker, who is Esther Woodbury, a disabled disability researcher, advisor and advocate from the Human Rights Commission. So over to you, Esther.
Tēnā koutou katoa, ko Esther Woodbury aho, ko Aotea kai tohu tumuaki hauatanga, mō te kahui tika tangata, kia ora koutou. Thank you so much for having us. The Te Kahui Tika Tangata, the Human Rights Commission, to talk about a disability perspective on long COVID. I just want to also acknowledge all the work that's been put into putting this together. It's a really important piece of work, and yeah, I hope there's lots of learning, and it's the basis for the start of a kind of longer conversation. So if we just flick to the next slide, please. There we go. So the New Zealand Human Rights Commission, Te Kahui Tika Tangata, it has been an organisation since 1993, when the Human Rights Act established us as the New Zealand's National Human Rights Institute. The New Zealand government signed up to a number of international human rights treaties since 1948. Originally, the UN Declaration on the Rights the UN Declaration of Human Rights, but we've actually since then signed and helped develop a number of other conventions and treaties on human rights that articulate more specifically what human rights mean in different forums. So if I just click one more, if you go one more. So the role of Te Kahui Tika Tangata is the promotion of those human rights that the New Zealand government has signed, facilitating resolution of disputes around unlawful discrimination. And I should say that one of the key areas of discrimination is discrimination on the basis of disability and in public areas of life. And one of those public areas of life is in employment. So discrimination on the basis of disability in employment is very much part of the work that we do, and we do receive complaints around that quite frequently. We also monitor progress against the treaties and conventions that the government has signed up to. We monitor policies and legislations that do or could affect practices. So we also make comment on new policies, new legislations. If you could go forward one, please. In terms of what we mean by promoting human rights, a lot of that is helping people understand their rights. So quite often this is the case where you might not, until you are pretty sure your rights are being infringed, you might not really understand what all of those rights are or what all of the protections that you have under the UN conventions. We also highlight human rights issues that affect particular groups. I work in the disabilities team. I work for the Disability Rights Commissioner. And so we look at human rights that in particular affect disabled people. And of course, disabled people are an extremely broad group or number of groups of people. We also help people to support realization of those rights. So not just that you have rights, but that you actually experience those rights. Could go to the next slide, please. And we also do monitoring around it. So we look at domestically or nationally, what is happening for different groups. And part of that work is we are part of the convention that I most closely work with, the UN Convention on the Rights of Persons with Disabilities, has a part of it requires an independent monitoring mechanism. So Te Kahui Tika Tangata is part of that. So what is happening for particular groups, and also how is New Zealand progressing towards the UN conventions that it has signed up to. So for example, we were before the UN Committee on the Rights of Persons with Disability in August last year in Geneva, where we supported the UN Committee to hold the government to account in terms of the progress that it has signed up towards, progressing towards the realisation of that convention. Next slide, please. So our disability rights work at Te Kahui Tika Tangata it intersects with both national and international laws. So international laws around the UN conventions, but also a lot of laws in particular affect the experience of those laws. So we work within both of those things with our work. Disability rights are most specifically articulated in the UN Convention on the Rights of Persons with Disabilities, the UNCRPD, but they're also articulated in other conventions as well, including Convention on the Rights of the Child, the UN Declaration on the Rights of Indigenous Peoples, for example. And all of the disability rights work we do aligns with Te Tiriti o Waitangi, which is also essentially a human rights treaty. It's an international law treaty. So we are very fortunate to be led by Sauno Malei, Dr. Karanina Sumeo, who's the Acting Disability Rights Commissioner. We're in the process of recruiting a permanent disability rights commissioner, as a former commissioner who spoke at your forum last year has gone on to be the inaugural chief executive of the new Ministry for Disabled People. Can I go to the next slide, please? So we talk about, human rights, we talk about disability rights, but they're actually very specific rights around employment and disability. So, and I should note as well, we're talking specifically about long COVID here. Our work covers kind of everything under the UN definition of disability, which covers quite a lot of things, but absolutely long COVID comes into that. Yeah, okay, I'll get that a bit later. But yeah, there's lots of different definitions of disability, but we have specific ones that we have under the UN Convention. We also have ones that sit under particular kinds of legislation, for example, health legislation. But generally speaking, it is conditions which affect daily living. Generally speaking, we would say long-term, and long-term means a lot of different things, but for Statistics New Zealand, it means 6 months or more. But actually, the UN committee has been very clear that the origin of the length of impairment is actually not as important as the needs that disabled people have when they for enjoying their rights. Oh, I think we just flicked a little bit back and forward there. I'm just going to go back to,
Well,
so I'll just go back to the,
wrong page. Do I need to go back one?
can we go back, yeah, very quickly to specific human rights? It's just one back one.
Sorry, it's not going back.
Okay, that's fine. I'll talk about the specific human rights around employment and disability. So under the UN Convention on the Rights of Persons with Disabilities, it specifically notes the right of disabled people to work and be in employment, and that the convention requires safeguarding and promoting the realisation of the right to work, including for those who acquire a disability during the course of their employment. Oh, there we have it. We have it right there. The other very particular right within that convention is the right to reasonable accommodation, meaning modifications or adjustment. And in the case of employment, that would mean modifications and adjustment in the workplace. I think what's important to note there is that denial of reasonable accommodation is a form of discrimination. So you come and talk to Te Kahi Tika Tangata about discrimination if you feel that you are experiencing it, and we have processes for that. So if I go back to reasonable accommodation, thank you. It means necessary and appropriate modifications and adjustments which don't impose a disproportionate or undue burden on the person on the party making the reasonable accommodation, where it's needed in a particular case. So obviously people need different kinds of accommodations, and it's to be able to ensure human rights and fundamental freedoms are experienced on an equal basis with others. And just to note that the emphasis is on the reasonable accommodation, that something will reasonably accommodate your need, it doesn't necessarily mean that the person who is granting the accommodation personally sees it as reasonable. So it's that you are reasonably accommodated in your needs. And could I go forward one more, please? And I'm just going to have a quick advertisement break, because as part of the independent monitoring mechanism, which I noted that Te Kahi Tika Tangata is part of, we're actually next week launching an updated guide to reasonable accommodation for disabled people in Aotearoa. So I think that could be a really useful basis for people to be able to kind of look and see how their experience fits with it. And that will be available next week, towards the end of next week, I believe. It's being launched on the 27th. So check out our website as soon as it
Esther,
is.
Esther, could I just get you to wrap up, please?
Absolutely.
Thank you.
Can I just quickly go to the next slide? I'd say that, the previous slide. Anyway, so I think what we would expect with long COVID is what we see with other disability discrimination. So people being, other people with chronic health conditions not being believed, conditions not being well understood, barriers to diagnosis and or contested treatments, and lack of disability support, and in particular reasonable accommodation and discrimination by employers. So I would strongly encourage you, next slide, to get in touch with the Te Kahi Tika Tangata if you have been experiencing discrimination. And we have a number of processes that you can go through. Thank you.
Many thanks, Esther, for that really informative presentation. Our next speaker is Scout Barbour-Evans, and they are a consultant from Kahukura Consultancy and a lived experience advocate of long COVID. So over to you, Scout.
Tēnā koutou katoa, ko taranaki te papatu whenua, kei te noho o ke o te pōti e nai nei e raro i te maru o Ngāi Tahu. Ko whakapanaki te maunga, ko te wairoa te awa, ko ngā te kahanunu rawa ko ngā te parau ngā iwi, ko takatimu te waka, ko kahanunu te tangata, ko Scout Barbour-Evans ahau. Tēnā koutou, tēnā koutou, tēnā koutou katoa. So kia ora, my name is Scout Barbour-Evans. I am a single parent from down here in the beautiful sunshiny, far too sunshiny right now, Poti Dunedin. I have been a prominent advocate for my entire adult life and some of my formative years for rainbow wellbeing services. And so through that mahi, I work through a lived experience and personal narrative model where I have meaningful kōrero about my experiences and the experiences of the people around me in order to enact change. I am a small business owner. I own Kahukura Consultancy. It's a very, very small, you could say boutique, but it feels a bit strange to say that, consultancy firm. It's just me providing support on academic projects and on projects that places like different government departments, different organisations want to do to make sure that they're supporting their rainbow whānau properly. A fun fact about me is that I flew a plane before I ever drove a car, and I still have flown more planes than I have driven cars. That's two planes. So yeah, and I have had long COVID since April 2022. So we're coming up on 11 months, no, 10 months since I first developed long COVID. Before I had long COVID, I had been working very hard to come to a place in my health and my well-being that I was able to get into the workforce. I worked very, very hard to recover from anorexia nervosa and to recover from a bout of chronic fatigue syndrome or myalgic encephalomyelitis that I caught from having glandular fever back in 2015. So unfortunately, that period of recovery didn't last very long before I developed long COVID. It would take me the entire 10 minutes to go through what long COVID looks like for me. But here's a overwhelming list of my symptoms and my experiences with long COVID. That one in the middle there, frequent viral and bacterial infections. I have strep throat right now. I was in bed up until about an hour ago. So as you might be able to guess, I'm not entirely cognitively here today, but I will do my best for you all. And obviously all of these symptoms really interfere in my ability to undergo meaningful mahi, and mahi that is going to not only financially keep me afloat and my daughter afloat as well, but fuel my wairua at the same time. I'm all about mahi that is good for the soul as well as the wallet. So before I had COVID, as I said before, I had myalgic encephalomyelitis from a bout of glandular fever, and this really hindered my ability to work. I spent 6 years doing voluntary roles within different organisations, including some skilled volunteering, doing disaster relief for organisations like the New Zealand Red Cross. I'm a graduate of the certificate in mental health and addiction support from what is now Te Kukinga, but from the good old Otago Polytechnic. And I hold a Bachelor of Leadership for Change, also from Otago Polytechnic, or now Te Kukinga, from that I graduated from in 2019. I did my final year of that degree with a newborn baby. Can't recommend it. I took a break from both mahi and study to recover from anorexia and have a hysterectomy and raise a young toddler. So you get the picture here. I don't take things by halves. I bite off more than I can chew all of the time, and I don't make enough money to account for the amount of mahi that I'm doing everywhere. I began Kahukura Consultancy so that I could work full-time and still parent full-time. Sorry, work part-time and still parent full-time. Unfortunately, as I was building up my business, I did develop long COVID, so I did have to severely reduce my work hours. And post-COVID, day 2, I was in the middle of an argument, and so out of spite, I wrote a literature review. Again, this is my brain. I just go and go and go, even when it's not good for me. And as soon as I finished writing that, and I mean, I feel like I won the argument, they disagreed. I slept for about 4 months. I could barely get out of bed. I could not cook for myself. I could not clean for myself. I could barely get myself into the shower. I was raising a toddler by myself through this. So there was lots of, you know, sending her to the door by herself to get the Uber Eats. I engaged with some news media and some social media advocacy, linked in with the New Zealand Long COVID support spaces. I've been participating in every single piece of research I can. If there's anything, I say take my blood. Take my blood, spit, limbs. I don't care as long as we find some sort of a solution. I've done a little bit of writing for the Long COVID Aotearoa website in the last couple of months, although I've crashed halfway through doing that and someone else had to finish it for me. I'm the chairperson at a local kohanga reo, which is where I am right now. I do some work in other academic fields. So I've just come back from Whanganui-a-Tara from doing some mahi at Vic. And I'm hoping to complete a Masters of Health in the next year, possibly not completed in the next year, but started in the next year. Possibly not till next year. We'll see how I go. So yeah, busy person. In terms of mahi, and mahi is not just about what we do in our paid environments. Mahi is about how we handle a household, how we give back to our community. It's everything that we do in our lives. And I have a very holistic view of what work is. So to be parenting, which is work, I've had to foster a lot of independence in my child, especially single parenting. So my 4-year-old makes her own breakfast, she washes her own plates, she vacuums her own bedroom, collects mail and takeaways from the front doorstep, etc. So I would not still be able to have my daughter at home if I didn't get a lot of support from my whānau. And at the same time, I don't have adequate support. I don't know how I'm pulling it off. I have a broken dishwasher and I can't afford to replace it, for instance. I have sent, at the end of last year, I was sending fortnightly emails to Minister Andrew Little talking about the fact that we don't have adequate accommodations and support for people with any chronic illness, let alone long COVID, and how we need access to things like home help and cleaning services. It doesn't even have to be all that much money per week per person. It just needs to be something. And he responded to every single one with, or he had a staff member reply to every single one with, here's the contact number for 1737. Talk to your GP. So as you can imagine, that has not been very successful so far. In terms of volunteering, I had to leave all my skilled voluntary roles besides my kohanga, my mahi at kohanga. And that's because I was experiencing huge barriers from other volunteers and from the leaders of our volunteer groups. So in most of my volunteer environments, I was told that it would be A, too much of a strain on our limited resources, which fair when I'm in this state, but B, long term, too much of a health and safety concern, because what if I got sick again? And that was a really harsh way to be let go. So unfortunately, because of that, I wasn't able to access any adaptions. In terms of my voluntary experience now, because I am the chairperson, I get to decide my capacity and to appoint what I do, and that's useful. I'm not actually 100% sure how much time I have, and my throat hurts.
Scout, I think you might be just about at the end of your session. Yeah.
Sweet. Thank you. So in terms of paid mahi and having long COVID, my business is financially very much struggling, and it's because I don't have the capacity to be canvassing for new clients at this point in time. And it means that, you know, things like the annual return time happened right as I was incredibly unwell and I didn't have the capacity to file it in time, little things like that. So it has cost me financially in terms of being a business owner. And I was not eligible for wage subsidies, even though I was directly impacted from COVID and long COVID, on account of the fact that...
Scout, I'm going to have to stop you there.
Okay, to play.
Sorry, we're going to have to...
This was my last slide. Yeah.
Running tight to time. Look, I would just like to applaud your bravery in sharing your journey. Thank you. Moving on to our final speaker for this session, session 2. I would like to introduce Dawn Duncan from the Faculty of Law at the University of Otago. Dawn, over to you.
Thank you for having me. I was asked to talk about rethinking employment, what works for all. And I've interpreted that to mean what isn't working currently and what can we fix. Given it's an election year, I'm going to shamelessly plug the areas of law that I think are absolutely terrible for long COVID sufferers and other people in the hope that we can improve on them. So the pandemic highlighted for us some massive weaknesses in our regulation of work and a huge mismatch between the realities of work, the needs of workers in terms of health, and the assumptions underpinning our laws and policies. Quite simply, we don't have a good regime in terms of meeting everyone's needs for the reality of work as it's currently being performed out there, and as COVID is changing things. The regime has some serious holes, which leaves workers and, of course, businesses without practical support and help. And it falls well below what we would get in comparable countries like Australia or Canada. These holes are a major problem for those affected by pandemic-related health conditions, and I use the term more broadly than just long COVID. Fixing those holes, in my view, is absolutely essential, not only to improve the situation for long COVID sufferers, but a number of workers who have been affected by the pandemic. So I've loosely grouped 3 categories of workers. The first is workers with long COVID. The second is workers with a pre-existing health condition that have either been impacted by the virus or the response to the virus. And I think it's important to look at both the virus and also what happened in the workplaces that are causing people's health problems. And finally, those with burnout, mental health, depression, anxiety, PTSD conditions that have either been triggered by the virus or the response to the virus, what's happened in workplaces as a result. Now, I'm grouping these 3 together, not in any way to diminish the long COVID unique experience, but to highlight that when it comes to law, when it comes to how people are experiencing the workplace, their experiences are often the same as those other 2 groups of workers. So people with chronic health conditions generally get a really poor treatment under the New Zealand regime. And the diagnostic categories, while helpful for medical research and clinical practice, aren't particularly helpful necessarily for us. So each of these 3 groups is being failed by the same gaps in our regulatory and policy response. Each of these 3 groups of workers could have their working lives greatly improved if we improved our regulatory response. And also on a purely kind of strategic level or a political level, it's easier or perhaps easier to achieve meaningful reform if we understand long COVID impacted workers as one of the groups of workers being failed by an inadequate legal response rather than the problem. So rather than focus on the long COVID diagnosis, focusing on what's happening in work and how we are treating workers with any kind of chronic health problem linked to the pandemic. So I talk about the virus and the response to it. And this is because the relationship or the causality in the development of some of these conditions is actually really complicated. It's not always the case that it's just the virus involved in long COVID or just the virus that triggers an underlying health condition. It's often also all of the other things that are happening in a pandemic affected workplace. We've seen infection trigger off some people's mental health problems. We've seen people's mental health problems being triggered by all of those additional hazards in the workplace. So I think it's really important that we look at both. So what does the workplace look like and what has it looked like? Well, of course, we've seen lockdowns which cause major disruptions, role conflict and isolation. We saw some jobs with massive increase in workload pressure. And that wasn't just for the short periods of the lockdowns, that's been ongoing for really the past 3 years. So if we look at jobs in health and education, especially, we've seen huge increases in people's demand. And not just the extension of hours, but the intensification of that work. So the mental, emotional, spiritual, psychological demands of those work has increased. We've seen a rise in occupational violence, so threats, abuse and violence, and we saw this in the earlier part of the pandemic during the lockdowns, but we've also seen this continue online. We've seen diminished social support, informal social support in workplaces, the community, etc. We've seen heightened anxiety and uncertainty at a personal level, at a workplace level, and of course globally. And workers, being unfortunately human, don't have the ability to turn off different parts of their brain so that they're only affected by work or only affected by particular things going on. Understaffing, sick leave and high turnover has had a massive impact. Expectations is one of those areas that's really now coming to the fore as workers are telling us that the pressure to return to normal is actually worse because things aren't normal, right? They haven't gone back to normal, workplaces haven't gone back to normal. And it's in the context of businesses making decisions around redundancies, staffing cuts and staffing levels. Now, these factors impact, of course, on that third category with work-related mental health problems who've either been impacted by these hazards or the virus itself. Those with long-term health conditions who are working in a perhaps less optimal working environment. And of course, those with long COVID who are trying to return to work or make decisions about their working lives, again, in a less optimal environment. So the areas where our laws are failing. First area where our laws are failing is in terms of our recognition of chronic health generally. So New Zealand has long suffered from health being the poor cousin to safety. So our Health and Safety at Work Act, its predecessors, probably the last 50 years, have really focused on accidental physical injury to the neglect of chronic work-related health problems. Now, especially mental health problems, but not exclusively. WorkSafe is well aware of the fact that health is the poor cousin to safety. And in the last few years, credit where credit is due, things have got a little bit better, but we've still got a really long way to go in terms of getting our health and safety responses to the level they need to be to meet the needs of workers and businesses, and also to the level of other countries. We have a lack of compensation and rehabilitation for affected workers. So our workers' compensation in New Zealand is paid through ACC. Unfortunately, ACC, when it comes to chronic work related health conditions, is really stingy and miserable. So there's a lot of workers in each of those three categories who cannot access ACC compensation for work-related health problems, whereas they could in comparable countries. We do have some really limited cover for long COVID sufferers in some very narrow circumstances. And if you can get an ACC advocate, you might be able to get some coverage there. If you've got an underlying health condition, chances are ACC will exclude cover. And if you've got a chronic mental health problem, burnout, depression, anxiety, PTSD from bullying, things like that, again, you're excluded from compensation in a way that you wouldn't be in comparable countries. And what that exclusion from compensation means is you're not getting your 80% of your pre-incapacity earnings. And that loss of income is a massive factor in people's lives. Access to treatment, and of course, social and vocational rehabilitation. We've also got big disconnections between health and safety, ACC, and our employment regulation. One obvious example of this is in relation to data collection. So in New Zealand, all of our official injury and illness data about the workplace comes from ACC administrative data. And what that means is we're only capturing data on those things that we compensate. So the legal boundaries about who gets compensation and who doesn't get compensation becomes the boundaries of what data we have and what data we don't have. So what that means is that our official picture of what's happening in terms of workplace health excludes burnout, depression, chronic health problems, long COVID. And what that means is we don't have the data to do research. It's not underpinning policy decisions. It's not being used as a target for WorkSafe or other enforcement agencies who are effectively regulating blind. We also have major disconnections between the personal grievance regime, sick leave rules and norms around that area as well. And finally, we have a lack of clear guidelines for employers. Now, it's really great to see the Human Rights Commission putting out that guideline around reasonable accommodations, because that's one area where I think a lot of employers struggle to know what they're obliged to do. But we've also got some gaps in terms of chronic health prevention, monitoring. How do you have those conversations? When do you intervene? How does it work in terms of leave? Those guidelines are also missing as well. So what reforms would I like to see? Well, I would like to see our ACC scheme become a more modern and equitable regime, have ACC coverage for work-related health problems, including the chronic work-related health problems, that not only achieves better health outcomes, better economic outcomes, better return to work outcomes for those workers who are affected by chronic health problems, but also results in us having better data collection, which supports research, policy and enforcement activity. I would like to see our health and safety system make health as much of a priority as safety. And we need to be a little braver about regulations and guidelines on the healthy conditions of work. So the last few decades, we've seen a real reluctance to regulate, or even for government to kind of indicate what expectations are in terms of healthy work. And I think we really need to be willing to do that. We need better suited enforcement tools. So poor old WorkSafe is working with machinery that works pretty well for accidental physical injury and isn't very good at all for things like bullying, psychosocial hazards, stress, chronic health problems, long COVID. It just doesn't have the tools and resources that it needs to. We need better employment relations, provisions that are actually connected to ACC and to health and safety. A set of modern sick leave rules for the workplaces we actually have that includes things like obligations to provide adequate staffing levels and cover when people are sick. Some clarity around what sick leave is trying to achieve, and some connection between the information you collect on sick leave, the information you connect on health and safety or ACC, and what that is telling you about the situation in your workplace. We need a clearer set of obligations in relation to worker health, whether that is reasonable accommodations, whether that is dismissal decisions, whether that is decisions about workload, whether that is job design. Those health guidelines need to be there. And finally, and I think I'm pretty much exactly on time, we need better working conditions and more equitable support for people affected by long-term illness in their working lives. So that's me. Bang on.
That was absolutely bang on. Many thanks, Dawn, for that really interesting presentation to finish up our session 2 in terms of our speakers. So I'm now going to hand over to Mona, who will facilitate the panel discussion.
Oh, thank you, Sarah, and many thanks to all the speakers. That was a really fantastic session, and judging by the number of questions, then I think the audience agreed. So I'm going to start off by a question that's been posed to Paula. This is a question from Alex. How do the discussions about economic cost and productivity loss change with the needed shift towards a steady state economy to respond to major global issues like climate change? And how should long COVID disability drive such a shift towards a well-being economy? Big questions there, but if you've got a short answer, Paula, we'd love to hear from you.
Yeah, thanks very much. And thanks, Alex, for just posing something that I'm now going to think about for the rest of the week and the month. And I sometimes think academics do a disservice to those who work in the public sector because we're constantly critiquing. But, you know, I would potentially hate their job right now. They are trying to instigate a living standards framework, which I think is great. Let's stop focusing on outcomes like growth and think about more about, you know, our well-being, you know, in that well-being context. But we're also just experiencing, and people are still experiencing, a cyclone. We've had floods in Auckland, and so climate change is on the agenda. How does Treasury and other agencies kind of model the fact that there's so much moving and so much going on? And in some sense, New Zealand and Aotearoa can't look anywhere else because we're quite unique in that sense. So I guess there's an awareness, and I'm about to do some work to try and to operationalise how do we measure living standards and understand if what the Treasury has imposed actually can be operationalised in terms of the data we collect. And so kind of like a watch this space, because I would think it would be interesting to understand there was some living standards and COVID stuff, so let's do some living standards well-being and long COVID. So it's more of a, what does this mean for your research, kind of just more research, and hopefully somebody in Treasury is listening.
Super, thank you, Paula. Next question is for Esther. How does the Disability Act work for preventing dismissal due to uncertain chronic conditions allowing return to work within, I think it's meant to be an unknown time frame?
Thanks,
so
Mona.
Uncertainty of long COVID, I guess, that we're guessing at. I don't know if you've any comments on that.
Unfortunately, there are no kind of very simple and like, hooray, as it turns out, here is an easy way to fix discrimination that disabled people face in employment. The UN Convention is essentially like, it's a norm that internationally we've agreed to move towards. The UN conventions are progressively realised, which means that when governments sign up to them, they say we are moving towards our policies and our laws, and the way that we work is moving towards this international norm. So in terms of like a particular laws around, there are specific laws around employment. But in terms of the New Zealand human rights, there are just kind of noting that what we do is strategic advocacy. So we raise concerns with the government, we monitor, we look into who's affected by different practices, who might be affected by different practices. And we also that's the strategic advocacy that we do. We also have a service for information about what your rights are. And we run a disputes resolution service. So if people are having a particular issue with their particular employer, for example, they may be able to get support to go through a dispute resolution process for that. Sometimes the dispute resolution processes still do not resolve issues. And it is complex because we have a lot of different laws operating in each particular issue. It's not just issues around human rights, but it's also obviously around employment laws even within human rights, and the example of reasonable accommodation, there still has to be a balance between what is possible for an employer, what is, whether there is an undue burden. So, for example, if I'm hired by a place, I would not expect a building to be demolished for it to be made more physically accessible for me, but I would expect there to be other potential modifications to a building to make it more accessible, or for an employee to allow me to work in a place which is accessible. And I suppose
I'm just going to have to stop you there.
Yeah,
for one
of course.
second. I want to squeeze in one more question, and actually what you just said leads on very nicely to it.
Perfect.
But I hope it's okay to say that I'm sure you'll be interested, you'd be happy to take questions from other people, either online or afterwards by email. But this is an interesting question from Andrew, which leads on very nicely, and I'm actually going to pose to Dawn. Really interested in the concept of reasonable accommodation and COVID risk, specifically whether organisations have an obligation to reasonably accommodate the needs of disabled population who are at higher risk of poor consequences for infection. So I don't know, Dawn, if you've any extra to add to what Esther has just been sharing with us.
It's one of those areas where the legal standard is that of a fair and reasonable employer. So the answer is maybe. Is there an additional need to provide reasonable accommodations? The Health and Safety at Work Act says you have to take all reasonably practicable steps to ensure the health and safety of workers who work for you, who are affected by your work, or others that might be in the workplace. Now, all reasonably practicable steps relates to your workers. So if your workers have underlying health conditions that might make them more susceptible or more vulnerable, what is fair and reasonable depends on the needs of those specific workers. So yes, there could be an obligation to take into consideration those additional needs and to provide more accommodations in order to meet those health and safety obligations. But exactly what will depend very much on the individual situation, on the circumstances, on the resources of the business. It's not entirely clear where those lines are. So my answer is a very unsatisfactory and loyally maybe. It depends.
Oh, thank you so much. That's actually really, really helpful to hear. So I'd just like to thank the speakers again. That was a fabulous session. And just to point out that I do recognise there were lots of other questions in the questions and answers that we haven't been able to address, but we will try to address those and provide answers virtually. Just to say, Natasha has asked really important questions about data, that Dawn highlighted the problems with data we've got, and Natasha, I'm always happy to talk data, so do flick me an email and we can talk more about those questions you have offline. We'll have a 5-minute break and be back at 11:35 for the next session. Thank you, everybody.
Thank you, everybody.